We all look forward to the weekends, but we're going to end our weekend on a great note because we've got a very important guest with us all the way from United States who's doing great work in an area that we all should know more about. And I'm really happy that Jess has come on the show today. So, as you know, an Intervention Matters podcast sessions are a platform where we discuss different topics related to neurodiversity. So, we're so fortunate today. We have Dr. Jess Armine. Welcome, Jess, and thank you for coming to the show today.
Thank you for having me. I'm really looking forward to speaking with your audience and giving some information from my point of view.
I'll ask Jess to give us a summary of his work in terms of his background because it's very impressive. Just if you could give us a brief bio or summary of what you do and your background.
Sure. I have been a healthcare practitioner of one form or another for about 50 years. And I started out in 1975 in New York City as an EMT and became a paramedic. So I did obviously pre-hospital emergency care. I then went to college for nursing and got my RN in 1978. And I did mostly ICU and emergency department nursing, or what they call in the UK A&E, and that was a real passion of mine. I spent about 4 years in the military doing exactly that. Then I decided that I wanted to become a chiropractor. I liked the philosophy and enjoyed it, so I got my chiropractic degree in 1986. Chiropractic was a lot of physical skills, but there were certain aspects of the profession that I didn't enjoy, and I became interested in the wider range of alternative medicine. One of my children developed schizophrenia, which kicked up my study and interest, and I started studying things like transmitter balancing. I took loads of courses. There's a new concept called neuroendocrinology and the genetic craze, and I was at the very beginning of that. So for the past since 1995, I slowly morphed into applying all those different things to looking at a particular case. And I found that there were, in especially complex multifactorial illnesses, that did not get significant improvement with other types of therapies. I found a common denominator, and that common denominator was at the cellular level. We talk about leaky gut syndrome. We talk about mitochondrial dysfunction. What does it all really mean? It means that your cells are not working very well. Okay, and what can we do about that? Well, it turns out plenty. And people talk about mitochondrial dysfunction, which is your energy producers. And if you're not producing your energy in the form of ATP, when it doesn't matter what we know the big long words, okay, your body's not going to heal. Well, of course, you're sitting up staring at us, so obviously you've got enough ATP to breathe, but it's a matter of degree. And if, let's say, you're working at 95% efficiency and you get ill and it goes down to 85%, these are numbers I'm just pulling out for example. In an acute condition, well, that's kind of expected. But if it becomes chronic, that degrades, and you simply can't heal, or can't heal very easily. Then you put something else on top of it, like the spike protein from COVID, and it might go all the way down to 60. And if it stays there, you're going to develop whatever your genetic predisposition. What happens is you develop a lot of oxidative stress, a lot of reactive oxygen species, inflammation, and so forth. And that causes wherever the weak links are to express, whether it's in your children, in yourself, or wherever. Okay. Of course, there are microorganisms that specifically go after different parts of the body, but the question always is, how come we're not fighting it? Okay, and this is where my interest went, and it turned out that functional medicine is simply a new iteration of, they used to call it complementary, complementary and alternative medicine, or just alternative medicine. Now, the term functional medicine is essentially that, but with a focus on the functioning of the cell itself, okay? Because people say, well, why are you concentrating on that? Well, if you put cells together, you get tissues. You put tissues together, you get organs. You put organs together, you get a body. So the stone left unturned that I found almost all the time was a lack of concentration there. That includes understanding the genetics and the biochemical pathways and where the glitches might be, in making sure the body gets the cofactors, which are vitamins and minerals, that they get absorbed into the cells, making sure that the cell membranes have what they need to repair themselves. Okay. And that's kind of a very basic thing. And then say looking for root causes that were up until this time either not investigated or not considered as part of or a root cause of a particular condition. Okay. So my thought process, my training makes me take a very wide view of things. And how do you do that? Well, take a very good history and really investigate if it's a child, what the parents say, and if it's an individual, there's ways of interviewing somebody where you get this kind of information. And that's where, you start seeing, gee, that could cause that, or just like Sherlock Holmes says, if you rule out the impossible, whatever's left, however improbable, must be the truth. So if
Yeah,
everything's been done and I'm ticking it off as of, okay, they check this, they check that, they check this, they check that, whatever's left over is what I should be looking at. And then I can
yeah,
dive into that. So I actually have it easier than most physicians because they've been so many places before they see me that it's kind of
same.
relatively easy to figure out what's going on.
Yeah. Thank you so much. I think one of the things that made me want to hear more from you is that literally I'm seeing children coming into my practice where sometimes the symptoms are so unexplained and we have gone through looking for causes and we can't find the underlying cause. So as you know, I'm a neurodevelopmental pediatrician, so we do assessments and for a lot of neurodiverse courses, diversity courses. And even when you've gone on and done that and put in support in place, there's some children that have what is almost like a persistent fatigue or tiredness or just low energy and just very poorly motivated. They're just chronically in that pattern and you've done everything that you want to the general
Exactly.
test that we do and we've tried hard to find I'm seeing them a few more again. And I also came across a few clinicians, very few, but who've taken an interest in functional medicine. I had the opportunity to interact with one of them at a conference where I became quite fascinated about what she was talking about. And she was somebody who had had a strong family history of strokes. She had suffered a few strokes herself, and she'd been going through the whole walks of different medical pathways. But she was talking about how functional medicine literally had been a rescue for her. And just looking at that approach had helped. And that's what had driven her interest in that. So it then made me think actually, there's a lot more that we need to know that we don't know. And as you said, lots of physicians actually do not look beyond the clinical aspect. That's why I felt it would be good to hear more
Sure.
about your work.
Happy to.
So there just there are many listeners out there who they're hearing about functional medicine for the first time. So how would you explain that to the regular person out there? What is it? What does it mean?
Functional medicine is basically alternative medicine that you've normally seen. You may be talking to a nutritionist, you may be talking to a chiropractor, you may be talking to one of a number of professions that are not MDs or DOs. And the training that you would get if you were to take actually the functional medicine courses, I just finished teaching one, is the point of view is to certainly understand the diagnostic process, understand what the general medical thought process is, and start looking at other things that could possibly cause a person's symptoms. We think of things like candida. We think, which is yeast. What we'll do is look at things from not only a different point of view, but search for those stones left unturned. That's what a good functional medicine physician does, and interacts with their medical colleagues. It's not, and no profession is an end all and a know all unto themselves. I regularly interact with my medical colleagues, and especially in England, because I spent a lot of time in the UK, where I used to before COVID. I would interact with a lot of GPs and say, "Gee, this is what I'm thinking about. Would you be so kind as to order these tests?" I remember a lady who had neuropsychiatric symptoms very badly, and I ended up doing a cortisol test with her. I mean, that's the stuff that comes out of your adrenal gland and makes you very awake. And it was
Mm,
highest I've ever seen that curve. And I thought about an adrenal tumor that's called the pheochromocytoma. And of course, once she got, once she, they did everything they normally do and they settled on the psychiatric problem, I wrote a letter to her physician and said, you know, your care is excellent, but this is what I found peripherally. Would you mind doing, I think you had to do like something like a metanephrin test or anything. Well,
mm,
anyway, it confirmed and then they did the studies and they removed the tumor and she got a whole lot better. Okay. Sometimes it's other allergic reactions that may not seem, and it's cause and effect. One patient of mine had dental work and had titanium plates put in. And then within weeks, she was psychotic. Now,
mm,
I sit there and say, well, is that possible? I never say that can't happen. As a matter of fact, if you ever took one of my courses and you said that phrase, you'd be tossed out. Okay. Because if I hear a temporal relationship, this and then this happened, I say, I wonder why that happened. Okay. Is it possible? At the time, we had something called the ELISA test, which they do now, but it
mm,
was for metals. And that test was done and, showed all kinds of reactions. And I talked her dental surgeon into taking them out. And he was very upset because he didn't see the normal reaction that he would have. But it was the only thing I could think of. And there was a temporal relationship. And of course, when he took them out, within weeks, she was back to her normal self.
mm,
Okay. The other thing that functional medicine will do, and this may go against the grain, is that I will work with incomplete information, okay, where the evidence hasn't caught up with the clinical practice yet. Although we know it's there, okay. A good example of that would be hypothyroidism that can cause things like fibromyalgia and weakness and so forth. Yet the thyroid tests are all within the normal limits. And I may do something like, well, how can I check that? I'll take their core temperature every day and see if it's, 37 is where it should be if I'm using Celsius.
mm,
Below, I forget in Celsius, but here it would be 97.5. It was below that consistently and taking into account the fluctuations, let's say, for hormones. And I'm thinking subclinical hypothyroidism. I'll do an iodine patch test, which is an old test by putting Lugol's iodine on your wrist and looking at it, and then, looking at it every hour and see when it goes away. That tells you whether the body's sucking in iodine because it needs it, and maybe
mm,
that's a reason for that as well. Okay, so it's a combination of some very old knowledge and old testing methods
mm,
that the typical evidence right now would not support, yet it exists. And it's sad because I know most of my medical colleagues would say, well, I can't treat that or I don't treat that and start looking elsewhere where it is primarily. And of course, if it is the thyroid, the question is, how come it became dysfunctional? How come you have antibodies there?
mm.
My thought pattern goes back to root causes and the fact that when something becomes chronic, just getting rid of the root causes doesn't necessarily resolve the condition.
Yeah.
That's been scientifically proven. Robert Navio, MD, PhD, wrote a paper on the cell danger response, which is how a cell reacts to assault. And he quantified that those things that kill a cell are things like toxins, makes sense, microbes, makes sense, but all the psychological, spiritual, and emotional traumas that we face injure the cell in equal measure. Okay, and also with the spike protein today from COVID. So when that happens, the cell will become dysfunctional and kill whatever's in there. And then there's pathways that reopen or reestablish normal cellular function. I like to call it rebooting, and then you go along. So you've had the experience of prescribing uh, antibiotics for strep throat.
Mm,
Usually, the first couple of days, the patient feels rubbish, so you know, and then they feel a little bit better. But then there's the day when they turn the corner, so to speak, and they get better rapidly.
mm,
That's when the cell danger response has resolved itself, which we do. But if that input is chronic or multiple, the cell danger response, if you will, gets stuck, and the cells won't heal well. Within that process I mentioned before, you don't get rid of your heavy metals. You can't absorb the vitamins. The inside of the cells becomes acidic or toxic, which is staying in the state that it was in order to kill whatever bug was in there. Okay,
Mm,
stays that way, so they become relatively dysfunctional, and that all happens within the mitochondria.
mm.
That's why there's concentration on mitochondrial function, because that's your basic way that your body heals.
Fantastic, fantastic.
It's
Thank you
it's
so
simply a
much.
different point of view. It's a different point of view. That's all.
Yeah. So if we just go into the nervous system, obviously thinking about neurodiversity, where would you place that in terms of the role? We've talked about illnesses, and you've explained that if the body, especially if the body is having repeated episodes of illnesses, it doesn't fully get back to its original state. It's almost stuck and it begins to malfunction. So, what happens in children where, with in relation to their nervous system, their brains, when they're exposed to this pattern? Because I'm just thinking about what you're saying, and I'm thinking we are seeing an explosion. I was talking to a colleague yesterday, and we were saying we're actually seeing an explosion of lots of illnesses. The rise in prevalence of lots of illnesses. There's more epilepsy out there, there's more diabetes out there, there's more neurodiversity out there. How would you look at functional medicine? I mean, look at that concept of chronic illness impacting on the prevalence of what we're seeing now, because it's happening and people can't really explain. There's a lot of
It's
research
there.
going on.
It's
Why are we
obvious,
having
right?
more of this, more of that? But really,
It's a good point. Why are children becoming more ill? Why is there more neurodiversity now? Neurodiversity simply means a divergence or a separation from the normal neurological function. In other words, things like autism, things like ADD or ADHD, things like Asperger's. Okay. Sadly, also that the ASD, autism spectrum disorder, is sort of the garbage pail diagnosis. We kind of throw a lot of stuff in there. Argue the fact that in 1970, at least according to the CDC here in the States, the incidence of autism was 1 in 10,000 births, and
yeah,
now it's 1 in 34. Okay.
yeah.
Now, our genes haven't changed. Okay. So it must be something else. And there's the toxic environment. Now, what does that mean in relation to what you're saying? It means that there are more things now that can cause chronic inflammation, chronic oxidative stress. Okay. And once that starts happening, you become less and less able to fight disease. As a matter of fact, it engenders all kinds of other diseases. It's sad that I'm beginning to see that, and I agree with it because I've been in practice a while, beginning to see it a lot in children. Not only neurodiversity, but diabetes, chronic fatigue, or I think in the UK we call it ME,
Mm,
and it's usually ME, chronic fatigue. But
mm,
the same. There's a couple of reasons why that happens. Okay, environmentally, we've gotten exposed to things like glyphosates, which we know directly injure the mitochondria, which is like Roundup. You spray it on a plant, it just dies. Well, that's how it kills a plant, by stopping the mitochondrial function in a plant. So it does the same thing in humans to a certain degree. We get exposed to a lot of preservatives, a lot of things that usually are used very well, very easily, and then you find out later on that they can create problems. The days of lead paint are gone, okay, but other things have taken its place.
mm,
And most of the nutrition is subpar. They eat bread that, was made with bleached flour and so forth, and the nutrients aren't there, and they're very hard to obtain, even if you're taking vitamins, because most of the vitamins don't get absorbed well. But the other things, the other microbes, parasites, viruses, and so forth, um, are more prevalent now. And since the pandemic, I'm beginning to see a lot of children get ill. And
mm.
I'm in the research groups for long COVID and what actually causes the dysfunction. in the cells. And the spike protein from COVID occupies, we know professionally, the ACE2 receptors,
Mm,
but those receptors are all over the body. And the end result of that is mitochondrial dysfunction. So basically, there are many, many root causes. And the other side of this coin is that, especially neurodiversity, the common wisdom is that there's no causation, but it's a roll of the cosmic dice. That's one of the things that I don't believe at all. I believe that there are root causes. And if you have the thought pattern that all we're going to do is compensate rather than look for cures, look for reasons and correct those, you're going to see the downstream effects of chronic infection. What are they? Well, those chronic things, like I said, chronic inflammation, different conditions that are resultant of the damage from the root causes. And one of the major ones is mitochondrial dysfunction. So when you have a child who is chronically fatigued, which should not happen, of course, it would happen occasionally, but that's a very unusual symptom for a child, at least in the before time. Now it's getting kind of common. We can blame it on all kinds of stuff, but the basis of it is a lack of mitochondrial function. And that is caused from what creates chronic inflammation. So it kind of looks like this. You have all these root causes, like I talked about, the cell danger response, toxins, microbes, and all the emotional stuff. That causes cellular disruption, and that happens in the mitochondria. We talk about leaky gut. Well, that means that the cell membranes are not working very well, and what's supposed to be in keeps coming out. What's supposed to be out keeps coming in. The cell membrane is just not a membrane. All your receptors are there. It does a whole mess of things. So when that is not working well, then you're going to have cellular problems. If the sodium from outside the cell goes in, the cell is going to swell and it's not going to work well. And when we talk about leaky gut syndrome, that's part of it. With leaky gut, once you have some kind of root causes that starts causing inflammation, then the gut becomes hyperpermeable, and antigens get in, and that creates a lot of antigen antibody reactions, which is an increase in inflammation. So sometimes you can get rid of the root causes and still have a syndrome.
mm-hmm,
It can get really technical, but essentially, we're being exposed to more toxins. Okay. I'm not going to get into the vaccine problem, but it makes sense in my mind that, vaccines that are given, which have adjuvants, things that there's in, like polyethylene glycol, aluminum, formaldehyde, that kind of stuff, okay, given to a neonate, baby just born, probably doesn't make the best of senses, but nevertheless, it's an accumulation. This I've noticed. How did I notice that? I take care of a lot of autistic kids. And the parents would have an autistic child, and I'm working with them. And then, of course, they have another child. And let's say they went to their pediatrician and they said, can we try an alternative, schedule, and sometimes they would do that. And the second child, who has the same genetic profile, because I looked at both of them, does not end up with autism because their body was allowed to recover from the immunization. But that's just one aspect. We enter into absolutism, which is wrong. It's an accumulation of things. It's an accumulation. There's more toxins around it. I don't think anybody's going to argue with that. That can get stored in your body. And those are heavy metals, all kinds of different things, and especially the plastics and all these different things. It's an accumulation of toxins, an accumulation of things that cause your cells to not work well at the mitochondrial level and also engender chronic inflammation, usually through leaky gut syndrome.
mm,
And once that inflammation starts building up, it's like a forest fire and it starts
mm.
feeding on itself.
Okay. So sorry. Thank you. Thank you. I think you've helped to give us the foundations of understanding what happens in the body with, exposure to different things, the toxins, the viruses, because what we see is an illness. And typically when people go to the hospital, symptoms are being managed. They're looking at the
Nothing
fever,
wrong
the
with that
cause of
either.
fever, which is good. But what happens later on in terms of the recovery of that person is something we don't tend to delve into a lot. Why one person will recover quicker and another person will take a longer time to recover. So just going now to how do people come to you for, consultations, and if we're looking at children now, at what point do they come to see you?
Well, they come to see me when they've tried lots of other things. Usually, I'm the last doctor on the list, and it can be a long list. And they've tried various therapies, and they're noticing their child is not getting better. Okay, they're not achieving the goals that they would like to see. A lot of autistic parents like to have their children talking, because they're nonverbal. And when that happens, that's when people usually seek me out. And I don't advertise, so they find me through referral, or they've watched one of my videos or one of my podcasts, and I'll go through their entire history again. I like to give them what I call a de novo hearing, which is a complete going through everything without prejudice, without preconceived ideas. I'll go over all the testing that they already have in hand, and the history is going to tell me what happened. Okay, it's going to give me some areas of suspicion. And if my index of suspicion goes with certain things, that's what we either test for or just start treating it. And I will use things that are not commonly known or perfectly safe, but not within the genre or the armamentarium of most practitioners, but they do work. And my decision point is the risk benefit factor. If there's very little or no risk, and my patient can benefit from it, that's how I consider treating. I know that there's a concern about all the various testing out there, and there's a lot of it, okay? And how much of it is important, and how much of it is, how can I say, just a lot of noise. Okay, there's two factors there. A lot of the tests are pretty good, but it's who is interpreting them. Anybody can read a test, but interpreting it means that you correlate it with the patient's clinical condition, which as a developmental pediatrician, you do very automatically. You sit there and you go through stuff, and it's like, okay, blah, 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 and that's significant. That's not. There are certain tests that are very informative. Okay, and I don't do a lot of testing because patients come to me with testing. I see the trends, and I listen to their history, and I ask lots of questions, and very often I only test for something that we really need to know about. Okay, but something like an organic acid test is very informative because what it's testing are the organic acids that are put out by the body that are in between the various enzymes in the pathway. So essentially, I can look at that test and see if they have some bacterial infections, whether they have fungal infections, clostridial infections. I can follow along the entity pathway, the glycolysis, Krebs, and look at the indicators of mitochondrial membrane integrity. I can look at their nutritional, whether they're absorbing their vitamins. I can see if they're breaking down their amino acids. I can look at their glutathione production and recycling, which is a really big deal because if you create glutathione adequately, once it gets used up, okay, it becomes oxidized, and we have a mechanism that recycles it. Okay, and if that's not working, there's a buildup of that oxidized glutathione, and that directly interferes with mitochondrial function.
Mm,
Fixing that is not a really big deal. It's usually just using an AD. You can look at the various systems and get a good idea of how the body is functioning. People
mm,
do genetic tests, and those aren't worthless, but they're misapplied. Because you have a genetic pathway that doesn't look like it's working well, does not mean you have the problem. Okay, it doesn't mean that, and we always get this with MTHFR, with it's called methylene tetrahydrofolate. So methylene tetrahydrofolate reductase, and it's treated like a deity or a devil. And it's one enzyme in the pathway, in the folate pathway, which is not extensive, but it involves other
mm,
enzymes. But it's treated like a very significant thing, and it's not. It's got to be
mm,
looked at, and it has to be looked at in part of a pathway, a part of the methylation. Dr. Ben Lynch has a program called Strategene that takes the genetic information and puts the information into the pathway so you can visually see it. I know
mm,
because I invented this. I invented the test, but I didn't have the kind of money to develop it. He did,
mm,
And it's a really great test, and it gives you some idea of what might happen under an oxidative stress load. So the trial I did this morning, you can see that a histamine pathway wasn't going to break down histamine very well. And if he has a lot of food allergies or whatever's going to create histamine, That's going to act as an excitatory neurotransmitter and create more leakage in the cells. His ability to create glutathione was fine, but his recycling was terrible. So you start putting that together and you say, okay, these gives you some ideas of how it may express, but what makes it express? Oxidative stress. Okay, if there's no traffic in those pathways, it's not a big deal, no matter how bad they look. If you concentrate on what is the body, why the body's not functioning, and look at it from that point of view, you can often intervene. But treating something like treating oxidative stress by giving anti-inflammatories, be natural or pharmaceutical, is not getting at the reasons for it. Okay.
Mm,
And the sad thing is sometimes people don't think there is a reason for it, but there is.
mm.
Okay. There's very few genetic things and they'll be present at birth, like Down syndrome or something. But even with Down syndrome, you look at the literature and it says, okay, this is what the kid's gonna have, but not necessarily. Okay. They can be very high functioning if you prevent or treat or stop the buildup of oxidative stress, the buildup of the inflammation, and they can be very high functioning. Yes, they're going to have some issues, but it does have to be, all this horrible stuff going on. Not necessarily. Not necessarily.
So when parents of children with neurodiversity come to you, what are usually their expectations and what do they commonly come to you for? What's the reason?
Well, a good example is this recent one, and the parents are very concerned with the fact that he's nonverbal and he's 12 years old. Okay, and that's the entry. That's fine. Okay, and what I did was go back in his history. I read all his tests, and there was some genetic tests there. There were some, they were kind of old, the organic acid tests and stuff. They didn't look all that bad. So I started out from the time that I was talking to mother and father today. I found out that, during pregnancy, they were giving her prenatals, but they have a lot of folic acid in them. Folic acid is not as good as folate. And I realize there's controversy about that, but that's one factor. When he was born, they gave him 2 immunizations in the hospital. He was a pretty good baby, but each set of immunization, his behavior changed, even as a baby. He crawled very briefly, and then walked. Okay, and walked on his toes a lot. That is 2 things. That's a lot of excitation in his brain, and 2, the primary neurologic organization that has to happens from crawling. So he would be very clumsy and stuff like that. But they did various things with him, and some of them were partially successful.
Mm,
Had him have speech therapy. The thing that told me the most of what was going on is they sent him to Germany for speech therapy for a few months. And there's different food there, there's different water there, and they had intensive speech therapy. And he came back. By the way, he was developing a speech, and he lost it 18 months. I'm trying to remember from this morning. I lost it with his last NMR that he got. Okay, it was very vaccine related. It's just, that's not the only thing that happens. But and then COVID went from making eye contact to not making eye contact and be like this. Okay. So that told me about spike protein. That's a possibility, which is damaging him further. Then we talked about these other things that were helping, and one of them was hyperbaric oxygen therapy that only helped for a little while. And the speech therapy, he came back and he was calm. He was speaking a little bit, but within weeks he lost it. Well, it tells you that his food was changed. So when I started listening, and here's
mm,
other things, what worked and what didn't, it led me to what is possibly happening. Okay. And I know that the spike protein is involved from COVID,
mm.
so I know how to detox him from that. I wrote a paper on it. Uh, it was published in the Journal of Public Health and Nutrition, peer-reviewed journal. It seems that there was some vaccine injury, which what does that mean? Okay. It means it damaged his cells and they weren't able to recover. And he created a lot of oxidative stress. So if we look at it from that point of view, and a leaky gut, which is absolute because when he went away and he felt better, comes back and he changes his diet back to what it was, and he gets worse again, it doesn't take too much thinking to say, well, that's the reason. So I'm going to do my best to reestablish his cellular function, correct his leaky gut. There are some other things that you can use to detox and that aren't extensive detox protocols, but part and parcel of helping to create glutathione. If you use augmented NAC, the N-acetylcysteine combines with glutamate to create glutathione.
Mm.
And, well, guess why? A lot of times we don't have enough cysteine, okay? And that's
Mm.
when, and also glutamate is very high, which is very excitatory. That's one of the ways of regulating because it uses that in the production of glutathione. And if you have the glutathione recycling, all these little things come together. And I say to myself, okay, I think we can get this kid talking again. Remember, I'm not going to do speech therapy. I'm going to set up the conditions where when he has speech therapy and he gets better, it'll stay. A lot of autistic kids have like brain therapy, the exercise and so forth. They work for a while, but then they fall back to where it was. That tells you that there's something going on that is untreated. Not because people don't care, not because the doctors don't care. They're simply not recognizing it as an entity. And that's why it would be so great for you and I, our professions, to interact, because we would look at it from the first, we would look at it at the beginning, and early intervention would include that, would
Mm.
include assessment of the cell, assessment on a functional medicine basis,
Mm.
inclusive of a medical basis. And think how much quicker people would get better if we simply looked at it together.
Yeah.
And early intervention usually means that they get diagnosed and they get services and stuff like that, and that's wonderful. But there's a large number of children that they get a little bit better, they get wet, they get a little bit better, they go back, and they're not really, the net is not real improvement. Okay. That population, by definition, has something in the functional medicine range that needs to be
Mm.
attended to. And again, not because people don't care, not because the doctors don't care. It's
Mm.
simply a point of view. So what I consider significant, others may not. And over time, that whole cause and effect thing, I'm like, I treat this and they get better. Well, whether you believe me or not, that's what it was. Okay.
So, are you aware of any research that's involving both the traditional medicine and the, because a lot of all these things that we've talked about, where we've also agreed that it would be good for both specialties to work together. Are you aware of research in neurodiversity where they're working hand in hand to actually look at things?
Yeah. Yeah. The talking about, let's say, the gut brain axis and neurodiversity. I was at the Ultimate GI conference in Dublin in September, and that's what I lectured on. And of course, to do a lecture like that, you have to, get all this the research together. So there is adequate research showing that the gut signals the neurological system, and there's other axes, but we'll talk about that one. There's plenty of research that is present, and it's in the main medical literature. You got to kind of pull it out, okay, and then put it together and show that not only is there signaling, there's also signaling from the microbiome, and that's new stuff that's coming out. But we had a
Mm.
gastroenterologist lecturing there, and that's what he talked about. That the microbiome being aberrant, like if you have candida overgrowth and so forth, is going to send different signals to the brain. Now, biochemically, I know that things like candida yeast produce acetaldehyde, which is basically formaldehyde, and that's going to build up, and that's going to injure the brain as well, make you more acidic and so forth. But the gut-brain axis can affect the gut, can affect the brain, and it affects it by doing neurotransmitter imbalance that's creating more inflammation. Okay, the neurotransmitter imbalance is going to give you the expression of what you're looking at, okay, whatever it happens to be. What
Mm.
feeds that is usually neural inflammation, okay? But that's only one aspect. And is there research there? Sure, lots.
Yeah.
If you go to PubMed, you can see it.
Yeah.
These
Yeah.
days, we were treating this a while ago with anecdotal information, okay?
Mm.
And remember that talking leaky gut just for a second, okay? Because I wrote a book on leaky gut. It's called Leaky Gut, Leaky Cells, Leaky Brain. It's on Amazon. So when I look at something like that, and I got a lot of pushback over the years about the existence of it, and even with the testing now, like the zonulin test, they have all kinds of symptoms in it, and it points to that. If that test is not positive, we'll say, well, there's no leaky gut. Well, there is. So if I treat something like that, what am I treating it with? digestive enzymes, some things like slippery elm or one of the dimulcent herbs. I may give them some butyrate or glutamine to help heal the cells, maybe a little bit of zinc for the tight junctions, and maybe some probiotics. Guess what? Am I hurting somebody doing that? Even if they don't have it? No. Okay.
No.
So the benefit is very high and the risk is minimal, if anything. So I bring it out, say, listen, almost everybody with a chronic condition has leaky gut. And I always get pushback on that. I said, well, let me ask you a question. If you treat leaky gut and it's not there, are you hurting somebody? But if the leaky gut is there and you don't treat it because you don't believe it's there, are you hurting somebody? Because that is going to be the reason why their inflammation continues to grow.
Yeah.
I come from a time where treating anecdotally, you just had to be careful. Okay. And that's where your knowledge came in. You wanted to make sure that what you did didn't pose a risk. You needed to understand and be able to look up the drug interactions with what you were doing. Okay. Because herbs can be just as strong as drugs. And you had to take that responsibility to make sure your patient was being well treated. Okay. But I will look at those anecdotal, those relationship things, those temporal relationships, cause and effect, and look at them and say, chronic Lyme and neurodiversity is going to cause the same thing. One of my original cases was a little 8-year-old girl who had olfactory hallucinations, auditory hallucinations, and visual hallucinations. Okay, and a very bad gut. We did minimal testing, but she had Lyme disease, anaplasma, and candida. Okay, I treated her leaky gut. I was working with an integrated pediatrician, and the only difference we had is she wanted to put a PICC line in and do rotating antibiotics, and I wanted to treat it a different way. And when we presented it to the parents, and they decided to do my particular care first, and if that didn't work, she was chronic, so it was no deal. And within 6 weeks, all of those symptoms were gone, and another 6 weeks I retested, and only the HAG6 was there. Everything else was gone. She's now 21, graduating from college, and she's going to medical school next year.
Wow.
But they were looking at giving her antipsychotics. Okay. Did anybody do anything wrong? No, that's their algorithm. That's what they're looking at. All I did was say, gee, this shouldn't be. And she had the medical workup. She had the MRI and everything else. I would never take her unless she had a good medical workup to make sure nothing else was wrong. And the mother came to me. I sent her. I said, you get all this stuff done. And if it's all negative, you come back and see me, which is what happened. Okay. But if they found a tumor, if they found anything else, I don't have any problem at all, referring out and saying, gee, this doesn't look right. No. And I have a large bevy of medical colleagues that I can call up and say, this is what I'm looking at. Can you, what do you think? I'm not proud, I don't know everything. I think I'm pretty intelligent, but the reason I'm intelligent is because I don't think too much of myself in that I'm not going to put anybody in danger.
Yeah.
Okay. But yeah, that's how
Do
I would
you
look.
do you get pushback from some of the medical people you see? Do you get
Sometimes.
pushback? Yeah.
But they're getting less and less as my generation is retiring. Okay, because I'll never retire. Sorry, I like this too much. Okay, really. When are you going to retire? Never. Okay. But that's why I teach a lot. I teach a lot of practitioners because I want to take this body of knowledge and give it to them and say, listen, just do it right, and then be there. Let me, work with letting you understand this as a total practice or part of a practice. And that's what I'm seeing now. A lot of medical physicians and allopathic physicians want to make this part of their practice, part of their thought paradigm. Okay. Which is pretty cool when they find things and they treat it and they're like, oh, person got better. Oh, yeah. Okay. It's cool though. It really is. But the people who gave the pushback they're kind of dying out. Okay. But still, it's really on my profession to take the reins and speak to our medical colleagues in their language. Okay. It's on us. Why would they understand all the nutritional garbage? Okay. Or all this other, what looks like woo woo. Why don't I just speak to them the way they understand it? Let me show them the evidence. And, once the evidence is there, once you sit there and say, oh, okay, that's a possibility. Then I show them case studies. Okay. Then it opens them up to just say, maybe it's a possibility. You just want to put it into the diagnostic consideration. You want to put it into the differential. That's all. And then people get treated better. Okay.
Yeah.
Most people are afraid when they have a chronic illness and their lab tests are normal, and they go from one practitioner to another, to be labeled as a psychiatric case.
Yeah.
And of course, in the neurodiversity realm, if they're not getting better and they're not getting function back and improvement, the only thing people have to remember is that whenever the kid finally became quote unquote autistic is kind of where they stopped progressing. So even if when they get this child to the point that things are beginning to work better, and there's ways of telling that, that's when the speech therapy will come in. He's not just going to spontaneously speak. He's going to have to be
Mm.
trained. But the training will go quick and the training will stick better. That's all.
Yeah. Thank you. You talked about the other causes. Can you shed a bit more light on the psychological, emotional, and the traumatic aspect
Absolutely.
and the impact? Yeah.
Well, depending on, all right, so let's talk PTSD. Okay.
Yeah.
There's many forms of PTSD, but the intensity of it, depending on the origination, the original cause. Okay. So um, a rape or being in a battle where you lose total control, because rape is not a crime of sex, it's a crime of violence. Okay, where the individual is, has somebody is totally controlling them to the point of almost fearing of death. That starts creating, there's a whole cascade effect over time that creates a breakup in the psyche. So unfortunately, what ends up happening is the people who damp it down, it's like putting concrete over an atomic pile like in Chernobyl. But as time goes on, that's going to crack, and the radiation comes out different ways.
Yeah.
So it's a cellular dysfunction, but the expression of that takes a longer time. Okay.
Mm.
If it's consistent abuse, like some child abuse or being with a narcissistic person, like a malignant narcissist, and that works on you over a long period of time, at some point you'll get ill. Okay.
Mm.
It will happen. Okay. But it's also an exacerbating factor if you have other problems. It could be a reason why you don't heal. I had a case like that in Taiwan. The girl from the UK had married an Asian guy and started becoming ill, and but she was in Taiwan, and the family was horrible to her. The husband didn't pay attention to her, and I found out she had Lyme disease. It was one of the case studies I do, and we worked with that. And she wasn't getting too much better until she got well enough to move back home to Scotland, I think it was. And then she got better rapidly. What do you think was happening there? Okay. Especially given the fact that the family of her husband was treating her so poorly. Okay. That was a constant stress. Okay. Constant emotional and spiritual stress. Okay. And
Mm.
there's this level of abuse in there also. But that is a great example. That being another factor that doesn't allow healing, even though the primary factor was Lyme disease. And when I did neurotransmitter testing, you can see there was a combination of
Mm.
acute and chronic, but she got better rapidly once she got out of the situation.
Mm.
That's a real good example.
Yeah. And we see that as well. I think when we look at some of the behavioral things that happen in mothers who have gone through assault or very toxic relationships and stressful pregnancies, that can impact on the babies. And when they come out, they have,
Absolutely.
and when you look at it, actually, you can understand where, cells have been damaged and those things continue. One of the areas of interest I have is fetal alcohol spectrum
Uh,
disorders, where
yes,
there's been exposure to alcohol in pregnancy, which has damaged the cells of the child. And the child comes out and begins to show all those things. And that's at the cellular level where things have been damaged and problems become quite chronic and affects different parts of the body. So I think when you're talking about, the cellular oxidative stress has gone on from the different aspects of things, we can understand why I haven't tackled the root cause, the problem persists and you have to try to get the body to a stage where the body can function better.
absolutely. Think of it as a bell curve. Okay.
Yeah.
If you have a bell curve and you have the mean, and you're only 1 or 2 standard deviations out. Okay, you have mechanisms that will keep you in within that
That
range.
curve, yeah.
But when you start putting these things together, you can be like several standard deviations out. And
Mm.
if you think about the way that we go about it, is that we kind of march them back to where their
Yeah,
own
it's supposed to be,
balancing
yeah.
mechanisms, yeah, their own mechanisms work. The trick with chronic illness is not only considering root cause, but considering what that root cause did. Because by the time it becomes chronic, there's certain chronic changes. I won't say permanent because they're not permanent. So if your gut is messed up, that's got to be fixed. If your neurotransmitters, the storage areas are low, because if you have a bad gut, you're not going to produce enough serotonin. That have that as a balancing mechanism. Okay, you have to treat both ends. And that's one of the reasons I've been very successful. I don't treat from this end, I don't treat from that end, but I listen. And if they've been treating from this end, great. It means they haven't been looking here. If they've only treated that and they didn't get better, well, they weren't looking down here. Okay. Or if they're treating from both ends, they may have not gotten far enough and have to dig in a little deeper.
Yeah. I think it's just fascinating how, the body can go through a process of healing. And I think what usually happens a lot of times is people give up and don't look at how to restore that process. And I think listening to your talk this evening is just explaining that and saying, actually, you can't get the body to,
You can,
back. Yeah.
but don't give up. Okay. Hopefully that what anybody takes away from this is that there can be other reasons. Okay. It may be a little confusing, but if you've given up, maybe it's time to kind of step back and take a good deep breath and, maybe we didn't look for this. Maybe we not stopped too early, but you did that on advice.
Mm,
Well, this is that. This will give him, and this is the way he
mm,
has it. It stinks to be him, okay, or
mm,
her. So maybe understand that there are other things that can be considered and, in fact, treated with the whole probability and a good probability of improving a person's condition because it hasn't been assessed, treated, and sometimes you have to work outside the solid evidence with what you
mm,
see on a regular basis.
mm.
Okay. You have to. And especially if over time, it's been shown to be efficacious and not injurious, not creating injury. Okay, it's not a sin to go work in that definite realm. I always tell my physician students that they have to learn to follow crumbs. Okay, follow crumbs. They're messy people anyway, so following crumbs is good for them.
Mhm, mm. Yeah,
But it's a wonderful thing because I love working with other doctors because when they get the gestalt, and I get an email 6 months from now, it's like, I did this with that person. And I didn't think they'd ever get better, but they are, you know. And I don't want the praise. It's just like that's great. A big
yeah.
smile on my face, like, all right.
And I think that's what, what we're talking about is that each group is not supposed to see each other. I think that's what happens is everybody thinks I've got ownership of this. I'm the only one that can solve this. Whereas we should be complementing each other in terms of working together
Absolutely.
for the child. And if there's any take home, one big take home from this is that we should come to this with an open mind saying, you do your bad bit. And if you haven't succeeded in getting that person back, because the outcome is to get the person back to a functional state.
Absolutely.
You might give all the medications you have. And like
Whatever.
for me, it was an eye opener with the last young person I was saying was, I'd done my bits. I'd sent them to the psychiatrist to do the bits about the anxiety. Psychiatrist had tried to optimize that as much as possible. She sent her back to me and said, just do not understand. She's so fatigued. And there's a young person that had actually been motivated to do well. When I saw her initially, before her neurodiversity was picked up and diagnosed, she was in a state where she just couldn't function. She had actually moved on to being able to concentrate better with the medications. Her anxiety had been treated to some extent too, but she was so, so, so fatigued. And because of that, she was not getting the optimum about what she needed. She was keen to go in and learn, but she just was not able to get that energy and motivation to go in. And I actually wrote to the GP and said, I think it would be good to, well, do some micronutrients testing and check this X, Y,
One
Z.
way to go about it.
But I
Sure.
think that she
Absolutely.
would benefit from some functional medicine approach to helping her get back,
When somebody's like that and there's a factor, other factors are better, but something like this, the first question I ask myself is, gee, there's something else going on. Okay. And I'll go back to the history and find out what it could possibly be. I have a guy right now who is horribly fatigued to the point that he can't leave the house. And he was a high functioning business person. So we went into his history and I found out that a lot of his focus problem stuff started in fourth grade. Okay. And he also said something that clued me, and he said, "Yeah, I started hating meat." Well, that's really unusual for a guy. You know, I raised three boys. So, when they became teenagers, they would just back up the cow and cut their own piece off. Those guys like protein. So it seemed to me that a lot of his symptom complex got worse and worse and worse over time. It got a little bit better, but worse and worse and worse. So I went back and I said, "Did you guys do a lot of camping around that time?" "Oh, yeah. We used to go camping all the time." I remembered that there's a certain tick that will give you a type of Lyme that causes alpha-gal syndrome and take away your taste for meat. And it fit into that. We're doing the testing right now, but it fits perfectly into a chronic Lyme case that just started progressing because Lyme likes the neurological system. He started losing his focus, and of course, then he got more anxiety and so forth and so on, and became less functional. And now he's very fatigued. So that kind of inflammation will affect the mitochondria. The root causes may or may not still be there, okay, but that fits that pattern. And so that's what I would do with somebody like that. There may be something else to treat, okay? And if we work together, if we were sitting there at a table going over the history together, we come up with different possibilities and then a course
yeah.
of action that allows us to look at everything. When somebody says holistically, they think I'm going to take the chicken and swing it over their heads or use crystals. That's always nice. Cast spells. Ooh, And yeah, I'm a Reiki master, and I know all that esoteric stuff. Nothing wrong with that. That's energy work. Okay, but if we work together and say, here's a possibility. Okay,
Hmm.
really, we check into it. Even by history or by testing. Testing is not always necessary. Okay, and too much testing is confusing. Okay, you get information, but the trick with testing is if there's something you really need to check and something you need to quantify, that's when you do a test. And there's great testing that you have to know which ones to do and also how to interpret it, just like you do, just like I do. Okay,
Yeah.
you just don't say do all these tests. No,
Yeah, I think that's been the problem with
it is
in some situations where it's almost like casting the net wide. But what you're actually doing is more on the detective angle. What could be going on, and what do I need to do to actually find out what could be
yeah.
wrong?
That's my nickname. I'm known as the Sherlock Holmes of chronic illness. And when I lecture, I'm
That's a
serious.
good
When
name.
I lecture, I put the hat on and point with the pipe.
That's a good name. Wow, it's been amazing, Jess. Just I think for me, it's been great having to break down what usually to a lot of people just look at it, oh, no, no, what it's functional medicine. Some people already develop a block. But actually knowing that you are looking, at what is really going on, what is the root cause of what's been going on, why is this person or illnesses one after the other, and they're not able to get back to being the functional person that they are. Because, like any physician, anybody that comes to you, you want to get them back to their function. You want to
Exactly.
get them back on their feet. You want to get them doing the
Absolutely.
things that
Absolutely.
they're good at. And that's
People
what
want to have a good
your aim
life, and
is.
they should.
Exactly. And if that's a common goal, we need to be working together to
Absolutely.
achieve that. Yeah. So it's been great. And you've really expanded this for families, what it means,
Thank
and
you.
bringing clinicians to the page where this is not scary stuff. This is actually what we need to be doing out there and understanding each other and working together. And you've actually taken us through some of the cases that you've dealt with and how you've worked with them, which has been good to actually get real life experiences. and just saying how you do it, because you're actually following the same framework that we would do in clinical practice, where you're looking for the cause, you're investigating, not casting your net wide, but like
Right,
you
exactly.
know
That's a
just focus test. Yeah.
just a real trick. If you go to see a functional practitioner, you consider it, and they want you to do several thousand pounds of testing before you see them, go to somebody else. You don't know what you want to test for unless you've already interviewed the patient extensively. Okay. So if they're like, well, we have to do these are all onboarding testing. Well, for my profession, that's nonsense. Okay. You sit down with somebody, you review just exactly what I said. Now, for other things, other professions, that let's say an oncologist or whatever, they have onboard testing. There's good reasons for all of that. Okay. But in my profession, if they're insisting on that, and especially if you have to buy the test through them, which they start surcharging the tests, okay, okay, that would be a big red
Red
flag
flags.
for me. A big red flag, big time. Okay. I'm serious. And
Yeah.
I don't like people who do that kind of stuff. Okay, because I never did.
Yeah.
And I see that it's out there. You just have to
Yeah.
be or have somebody has a massive practice and and of course they're on TV and so forth. And you see them maybe once, and then you're treated by an associate who you don't know if they have any kind of training. You went
Yeah.
there to see that person, okay, the person that you saw on TV, the person that you interacted with, but
Yeah.
that's not nice, okay, and it's not appropriate.
Yeah, and it's not nice because people are vulnerable at that point and they just want help. So it's not nice to get exploited in that way.
Yeah,
Oh,
I agree
thank you
with
for such a wonderful session. So now going back to your practice, where can people find you? Because we do put that information in our podcast.
you.
How yeah,
They can get me at my website, drjessarmine.com. I'll send you a link because what I do offer, and by the way, I have an international practice, so if you're in the UK, that's not a problem for me.
yeah,
People everywhere. So sometimes with Japan or Australia, I'm up at night like this.
yeah, there.
But I'll give you a link I offer a 30-minute complimentary, I call it a discovery session. And we just sit down, we chat, and this way I can look at you in the face and say, yes, I can help this type of case. And then we can see if we're a good fit, if we work well together. Okay. That's important because I don't take a lot of people. I have a small practice because I spend an awful lot of time in each case. And so I don't accept every case. The ones that I know I can help, the ones that are in bad shape, I will jump in with both feet. So everybody gets 110% out of me. Okay. But
Fantastic.
that's how they get in touch.
And what about your teaching as well? Where do you do your teaching? How can people
I teach
be
for
part of
various
that?
organizations, the Nutritional Collective of the UK. I've lectured several times. There's a functional medicine course that we just completed. And then we're going to be recycling that and expanding it towards the end of this year. I've taught for the LDN Research Trust. In the past, I've worked with, created different seminars and so forth. I normally am asked to speak at different conferences. And if somebody wants to go to my YouTube channel, which is Dr. Jess Armine, okay, I had a ton of videos, a ton, and they're on loads of different subjects. There were interviews or podcasts I did in the past or whatever. And if you wanted to go through there, you could see a lot of different things, and maybe you can learn stuff. Because what I'm really known for is taking real complex things and making them easy to understand. That's my big forte, and that's what I love doing because I think in cartoons. Everything I learn in a cartoon. And I'm looking at genetics. I'm like, that's Bugs Bunny. I put it like that. That's Danger Mouse. Okay. Yeah. And that's how I remember it. And, when I have that framework, I can go into how it feeds into other, you know, areas. But that's also how I teach because, jumping down the rabbit hole means you're going to get analysis paralysis. You need to be able to look at the whole, which means you have to understand the rabbit hole, but you need to be looking elsewhere. You need to be looking at the big picture, the big tapestry. And thinking in cartoons is very helpful.
Thank you. That's a good reminder for me. And where do you get your energy from?
I get my energy because I really love this. I mean,
Yeah.
I'll be sitting there like, and I start talking to people like, I'm just a big kid. I'm serious.
Good.
I'm
It's good
just a
to
big
remain
kid.
that way.
I'm
It's
literally
good
just a
to,
big kid. Yeah, it's like,
yeah,
okay, we're gonna have fun now. All right, let's have a good time. And I love taking somebody who is fearful and explaining stuff to them and seeing them. Okay, that's how it works. Great, and then calm down because you and I both know that what really kills people is fear.
fear.
Fear will turn off your immune system. Okay,
Mm,
and how do you fight fear? Well, you fight fear with knowledge. Okay, and nobody's going to be impressed that I can pronounce polysyllabic terms or I know all the
mm,
pathways and I can chatter them out. They'll be impressed that I can explain these things and so everybody can understand it.
yeah,
You have whatever level of training, whatever level of education, and understand the exact things that are happening. And it's simple when I put it together, it makes sense.
yeah,
You say, "Oh, okay." They go, "Okay." They know perfectly well that there's not an answer to everything. We're going to have to,
yeah,
when I first
yeah,
take somebody, I work with them every 2 weeks because we need to make course changes. We need, not everybody responds well to everything. I know that, you know that. So that's what I do, but that's why it's successful.
yeah. No, it's amazing. It's just, I've been fascinated just listening to you. And I think it's just developed my, awakened
It's a
more
pleasure
interest
chatting.
in actually, but for other clinicians listening, I think we do get patients. We do get people who come into our offices, our clinics, where we've got that, what could be going on moment. And it's just to take a step back and think through what could be going on, what's the root cause of what's going on. I think that's one key message for clinicians that, keep an open mind, keep an open mind, what could be going on. All the tests may come back as normal, doesn't mean there isn't something going on. And yes, be prepared to work with
Just
it.
remember your basic training. If you didn't know it existed, how could you diagnose it? Okay. We
Exactly.
work together.
Yeah.
And if we open up to each other, the things that I consider important or significant that in your training may have not been overly significant, when we open ourselves up together, we increase our ability to diagnose.
Yeah.
Look at things from a different point of view, a combined point of view. We're absolutely going to be successful.
Yeah. Yeah. Okay. Thank you so much, Jess. It's been an
Thank you
amazing
very much.
session. And thank you. I look forward to learning more. And I'm looking forward to having more research coming on in neurodiversity because I think that there's still a lot we need to learn and know.
Well, if you send me an email, I'll send you some of the research that I have. Okay, that
Okay.
you might find useful.
Thank you. Yes,
You're most
I'll send you an email because
Thank
that's
you.
something that's of interest. Thank you so much. Yeah. Thank
Okay,
you.
take care now.